We look after older persons who live in the Dublin West and Dublin South City area, and we are aligned to St James's Hospital. A large number of people we work with are living with dementia. We are a multidisciplinary team that works across the acute and community healthcare settings to wrap around the older person and their families. Our community-based services allow the older person to access integrated care and support that is planned around their needs and choices, enabling them to live well in their own homes and communities.
As the occupational therapist working within the ICPOP team, my focus is ensuring that my involvement with the person enables them to do the things that are most important and meaningful to them, including facilitating their preference to live where and how they wish, and in a way which best meets their ability and care needs. To date, my caseload has involved a broad range of clients, including people with a diagnosis of dementia whom are living in the community, along with clients who initially required hospitalisation. Through occupational therapy rehabilitation, delivered within their own homes, these individuals can be discharged from hospital earlier, as their programme of rehabilitation will be designed for their home environment and their specific needs. I am met with great levels of buy-in from the individual, as they're motivated to work for their own functional improvements.
I see the ICPOP team as ideally placed to deliver on Sláintecare goals of the right patient getting the right treatment in the right place at the right time. We achieve this by identifying patients in the community that are at high risk of a crisis ED attendance, often as a result of dementia. We proactively manage them from home. We've looked after over 500 complex cases and are successful in preventing ED attendances, hospital admissions, and significantly reducing carer stress.
2017, my mother was diagnosed with dementia. At the time she was doing okay. She could manage to cope living on her own with carers coming in twice a day. In 2020 my mother got COVID and put her dementia up the mountain and down again. She really got it very bad. When she came home after COVID, she was bedbound and I was left to my own devices. I didn't know what to do. She wasn't eating, she wasn't drinking, so I contacted her GP. Her GP put me on to the best help I could ever have for her and for me, Donna, her district nurse. Donna did everything possible for me, helped me out every single day. She got doctors to come to the house, changed my mother's medication, made my mother more comfortable. I wouldn't have been able to do it without her. She got everything possible.
So by providing a care coordinated approach, we can look at measures that can help family and family caregivers who have the emotional side of the caring and not only the physical. So how we supported that is by putting increased package into the home, trying to look at things like the Alzheimer's Society therapeutic home-based care, and providing support to Linda, because Linda to me was key in keeping this wish of Betty alive, and that's what we done.
Eventually my mother had to go into a nursing home, which she resides there now. She's 5 months in Our Lady's Hospice. I couldn't have done it. I couldn't have done what I'd done for the 6-7 months that I had my mother at home without having the support of Donna and her team. They were absolutely, there's no words to describe what she is. She was like my security blanket, because no matter what time of day or night that I'd ring Donna with a problem, she solved it for me, because that's what she is. That's her and her team are miracle workers.